it's just such a trusted resource. And I think that that's what's so important, because you can read a lot of different books. You can try to Google. And I guess I just feel like the information is so well vetted. And I think that for me, that's something that I've been looking for, to have that trusted source. The gentle reminders of getting the text just really brings it top of mind. And it when I get them, I just am kind of empowered that I am prioritizing my health, and I'm going to take 15 minutes, 20 minutes and read through this, and then go back and revisit it and, make some impactful changes. The brain health, it stood out to me so much because the recommendations that they provided to take frequent breaks. And I thought I was, but it brought my awareness up. And that when I started really tracking it, then I realized that I kind of keep my head down, and it's probably understandable why I have brain fog. And so just the strategies that I was able to implement, I can see a huge difference. And I think that's the biggest part of the program. Even with nutrition, we all think we're eating really well, and the accountability of really writing things down and diving a little bit deeper into what your daily habits are, I think makes such a big difference. And I really appreciated the music one too, and am trying to use that so much more, because it does make a big difference. And I think my overall mindset, as well as the awareness, how I'm feeling in different areas, I think being more strategic with whether it's listening to music when I can, or getting up and moving around, taking those frequent breaks. When I went in, I was only thinking of these symptoms. And then as you get more and more educated, and it brings to your awareness of, here are some other things, then you're able to understand more what you're dealing with and come up with some solutions where I probably wouldn't have put those connections together. No, I think that it's hard to diagnose, and you could have a variety of symptoms and things happening that you wouldn't necessarily put it to menopause. And I think that was very impactful for me and eye-opening, that you're experiencing a lot of these things, and they could all be interrelated, whereas I would have separated some of the symptoms.